Welcome to the Deep Dive. We sift through stacks of information to bring you the insights that matter. Today, we're on a really fascinating mission, actually. We want to explore how we can pave the road for medical experts, people like Dr. Haidar, to use their incredible depth of knowledge in things like neurosurgery and neuroanatomy. The goal, to help them create a video game, but not just any game. We're talking surgically and anatomically accurate, built using powerful tools, maybe something like Unreal Engine, to genuinely prepare surgeons for all sorts of complex situations, and crucially, in a completely risk-free environment.
It's an incredibly exciting idea, isn't it? Marrying that cutting-edge tech with deep, deep medical knowledge. It's not just a possibility anymore. Our sources suggest it's becoming vital, really vital, for the future of how surgeons are trained. So yeah, let's unpack how a project like this isn't just aspirational, but actually a blueprint we can work towards.
Okay, let's start there. Surgical training. Where does it stand now, or maybe where did it traditionally stand? Our sources talk a lot about this apprenticeship model, basically learning by doing, right there in the OR.
Yeah.
But while that old foundation seems to have some serious cracks appearing, what were the main issues?
You've hit on it exactly. I mean, that model worked for centuries, but it's under immense pressure now. Think about it. Fewer hands-on chances because, well, patient safety has to come first. Trainees get really varied experiences too, depends who they're learning from. And then there's the sheer cost of operating room time. It keeps going up. Plus, we're seeing all these new complex techniques like minimally invasive surgery, demands incredible precision, skills that are really tough to just pick up on the fly, and layer on top of that restrictions on how many hours trainees can actually work, less time for practice. So the big challenge becomes, how do we get future surgeons proficient, confident, without ever putting patients at risk?
And this is where things get really interesting, isn't it? Our research points towards simulation-based training. It seems like it's emerging as more than just an add-on. It's like a whole new way of thinking. It's not just see one, do one, teach one anymore. What's the real game changer here?
The aha moment, I think, is realizing simulation offers this repeatable, always available, stress-free learning environment. It fundamentally removes the risk to actual patients. That's huge. But what's truly transformative, especially for what we're talking about today, is this idea of a serious game. Okay, so unlike a game purely for fun, a serious game's main goal is something else entirely. It's designed, purposefully, to be this highly efficient, engaging way to build critical skills. Imagine a game not just to kill time, but to master saving lives. Our sources really stress how these games can actually blow past traditional learning methods. Why? Because they immerse you, they give you instant feedback, and you can practice endlessly without any real-world consequences.
Okay, so if we're aiming for something that accurate surgically and anatomically for something as complex as neurosurgery, this clearly isn't a one-person job. It feels way beyond what one developer or even one surgeon could manage alone. So what does this imply for putting together the right team? For Dr. Haidar's vision, for instance.
Yeah, what this really hammers home is the absolute necessity for multidisciplinary expertise. It's non-negotiable. Our sources are really clear. Effective health game development, especially for super specialized fields like neurosurgery, it demands people from totally different backgrounds working together. You need game design gurus who understand engagement, mechanics, user experience. You absolutely need the healthcare pros, the neurosurgeons, the anatomists, bringing that deep medical insight. And crucially, you need the end users involved from day one. The surgical trainees themselves, their feedback is gold.
It sounds logical, bringing everyone to the table, but I can just picture it, getting these different worlds to mesh, different jargon, different ways of thinking, maybe even different priorities. What's the trickiest part of getting, say, a neurosurgeon and a game developer on the same wavelength for such a high-stakes project? Did the sources give any clues on how to bridge that potential gap?
Oh, absolutely. And it's not just language, it's fundamental differences in work cultures and values. Early projects, they often hit snags. Things like a lack of common understanding, just basic misunderstandings, different ways of working, Game designers iterate, they test, they focus on the player experience. Surgeons focus on precision, established protocols, patient outcomes. Sometimes roles weren't even clearly defined. So finding common ground isn't just about translating terms, it's about building mutual respect and trust. What the lessons learned really highlight is that clear communication is just paramount. It's everything. One really effective strategy our sources mentioned is appointing a dedicated game producer. Think of this person as the central hub, maybe even a kind of cultural translator. They smooth things over, make sure the medical experts' needs are understood by the tech team, and vice versa. Ensure everyone is genuinely heading in the same direction. Because without that, you risk building something technically brilliant that surgeons can't actually use effectively, or something medically sound that's just a terrible game.
That makes a lot of sense. The central coordinator sounds vital. But okay, beyond just having that go-between, how does a team this diverse actually, share ideas effectively, especially for something so complex when some folks might be totally new to game development concepts? Are there tools for that?
Exactly. And yes, there are practical tools designed for exactly this kind of cross-pollination. One approach that seems really effective is using rapid prototyping workshops. These are like intensive, short guests designed to quickly get health professionals up to speed on game design basics. It's about creating a shared language, even a basic one, and getting them comfortable enough to brainstorm game ideas together. Another really useful tool mentioned is something called an SG design canvas. SG for serious game. Think of it like a business model canvas, but specifically for serious games. It's basically a single sheet that helps the whole team map out the game's goals, who the players are, the core mechanics, the resources needed, everything in one place. This canvas is especially great for the non-game developers, like maybe our Dr. Haidar. It gives them a structure, a way to articulate their detailed medical vision so the development team can really get it right from the start. It helps flag potential technical hurdles or resource needs early on, which avoids a lot of pain later.
Okay, this brings us right to the absolute heart of Dr. Haidar's vision, making something surgically and anatomically accurate. We're not talking about simplified models here. We mean something incredibly precise, almost like a digital twin for surgical training. How do the sources say you actually achieve that level of realism inside a virtual world?
This is where things get really intricate. It demands the seamless blend of medical illustration, highly precise anatomical modeling, and advanced haptic feedback. Our sources state pretty clearly, creating anatomically accurate digital organ models is step one. It's the foundation. And this isn't just about making things look good. It's about functional accuracy. Medical illustrators are absolutely key here. They have this unique skill set. They can visualize incredibly complex anatomy, entire surgical procedures step by step, even pathologies like tumors. Their work allows for these hyper-realistic virtual environments. They create high-fidelity graphics, not just of the target area, but all the surrounding tissues, the instruments. Every detail matters for immersion and accuracy.
Okay, so the visuals are covered. Incredible detail, bringing the anatomy to life virtually. But what about the feel of surgery? Surgeons don't just see, right? They rely so much on touch. Feeling the resistance of tissue, those subtle texture differences, judging depth, feeling a pulse. How do you replicate that tactile feedback?
That is a massive, massive question. And what's fascinating here is this concept of haptic fidelity. Haptics refers to the sense of touch and proprioception, your brain knowing where your hands are and what they're doing without looking. It's absolutely crucial for a surgeon to learn how to handle delicate tissues without causing damage, to literally feel their way through a dissection plane, to avoid hitting a critical vessel, to palpate a tumor and understand its consistency. Now, if you don't get that haptic feedback right in the simulator, our sources warn about a really serious risk. It's called negative transfer. Imagine a trainee gets used to applying a certain force in the simulator because the feedback is off, maybe too stiff or too soft. Then they go into a real OR and apply that same incorrect force, potentially causing harm. It means skills learned in the simulator could actually be detrimental in the real world if the haptics aren't accurate. That's a huge patient safety issue.
Wow, okay. Negative transfer. That's a serious concern. It's almost counterintuitive, isn't it? A training tool potentially making things worse, if not correctly. So how on earth do you make sure the haptic feedback is accurate? How do you avoid that negative transfer? How do you measure something as subjective as touch?
That's the core engineering challenge right there. Our sources emphasize you can't just rely on asking experts, does this feel right? Why? Because memory and interpretation of touch vary so much, even between highly experienced surgeons. It's too subjective. So the assessment of haptic fidelity has to be objective. It has to be beta-driven. This means digging into the biomechanical characterization of actual tissues. Think about precisely measuring the elasticity of brain tissue, the force needed to cut different membranes, the texture difference between healthy tissue and a tumor. You measure physical properties, texture, shape, volume, even temperature sometimes, and mechanical properties, how tissues react to being pushed, pulled, twisted, compression, tension, shear forces. It also involves measuring the actual forces surgeons apply with instruments during procedures. By gathering all this incredibly precise, objective data, developers can then program the haptic devices to replicate those forces and sensations realistically. It really pushes the limits of material science, robotics, sensor tech.
That's incredibly detailed. Sounds like a massive effort just to get the feel right. So based on all that objective measurement, does it mean you can kind of dial the haptic realism up or down, depending on what skill you're trying to teach? Is it all or nothing, or can you scale it?
Yes, exactly. It's scalable. Our sources talk about 3 distinct levels, generally. You've got low haptic accuracy. This might be fine for just basic stuff, like learning to handle instruments, pick things up, basic hand-eye coordination. Then there's medium accuracy. This could help a trainee get familiar with the overall steps of a procedure, maybe navigating through simpler anatomical structures. But for the really fine technical skills, things like delicate tumor removal or that super precise neurovascular dissection work neurosurgeons do, where tiny movements are critical and tissue damage is a major risk, that's where you absolutely need high haptic accuracy simulators. The fidelity has to match the complexity of the task.
And bringing it all together, where does a powerful game engine like Unreal Engine fit into this picture? I mean, it comes from entertainment, right?
Yeah.
How does it enable these incredibly complex, accurate medical simulations?
Well, if you look at the big picture, a really robust game engine like Unreal Engine provides the underlying framework, the engine. It's the sophisticated software backbone needed to create these detailed virtual reality, or VR, and augmented reality, AR, environments. Our sources highlight how VR, powered by engines like this, lets users step right inside these detailed 3D anatomical models. They can interact, practice complex procedures repeatedly, explore from any angle, all totally risk-free. What's also really exciting is that some platforms mentioned in our sources are already using VR for collaborative 3D anatomical modeling. Get this. Medical professionals in different cities, even different countries, can work shoulder to shoulder in the same virtual space on the same patient-specific 3D model, planning a surgery together in real time. That kind of collaborative capability is invaluable for iterating on designs, for surgical planning, and for bringing a vision like Dr. Haydar's to life safely and effectively.
What an absolutely incredible journey we've taken today, really exploring the potential here. From seeing the limits of the old ways of training to understanding why you need these diverse teams, and then diving deep into the weeds of anatomical accuracy and that crucial haptic feedback. It makes it so clear that building these kinds of surgically accurate training games isn't just some sci-fi dream. It feels like a tangible, almost necessary step for the future of medicine.
Indeed. The potential is just immense, isn't it? Preparing surgeons for the unexpected, for complex cases in a space where they can practice until it's second nature, all without risk. It really allows for mastery in a way that wasn't possible before. Which I suppose raises a final thought for you, our listener. Given how fast technology is moving and what we're learning about effective training, what other critical areas in healthcare, what other fields could be completely revolutionized by this kind of detailed, multi-sensory, collaborative simulation? Where else could this make a difference?